Hi there, everyone. We're back again. I remain Dr. Rayhan Folarin, and it's my pleasure to welcome you to today's episode, which is going to be centered on a topic that lies at the heart of modern medical advancement and personal decision making, and that is assisted reproductive techniques. See, these groundbreaking techniques have redefined possibilities in fertility treatment and thereby offering hopes to individuals and families across the globe. But alongside their immense potential come also profound ethical dilemmas and thought-provoking questions about future reproductive medicine. So that's why today we'll be exploring not only the science behind these techniques, but also the moral complexities and the exciting emerging trends that are shaping the field. So whether you're a healthcare professional or a student or someone eager to just learn more about this evolving topic, this episode promises to be both enlightening and engaging for you. So sit back, relax, and join me on this journey to uncover the intricacies of assisted reproductive techniques. So let's dive in. In today's meeting, we're going to be exploring the key assisted reproductive techniques and their respective, clinical applications. We intend to also discuss the ethical dilemmas and implications that surround these assisted reproductive techniques, including, disposal of embryos and matters like selective reduction. We intend to also highlight the emerging trends in ARTs and their potentials to revolutionize fertility treatments, and we intend to also encourage a thoughtful discussion on personal and societal impacts of these techniques. Finally, the goal is to empower viewers with a deeper understanding of ARTs in order to be able to make informed decision and personal and in personal and protect and professional contexts. So, by way of introduction, reproductive technologies really play a crucial role in helping individuals and couples to achieve pregnancies whenever it becomes challenging or impossible to conceive naturally. And it encompasses medical interventions that aim to assist in overcoming that infertility, thereby facilitating, conception. And it usually ranges from artificial insemination to in vitro fertilization, as we'll explain in a bit. So this field has really evolved significantly since the mid 20th century, uh, experiencing a lot of advancement and accelerating in recent decades due to technological and medical breakthroughs that have made it improved tremendously. What do we understand as infertility? It's generally defined as the inability of a sexually active couple to conceive a child after a year of regular and unprotected intercourse. And there are two categories of it. It is regarded as a primary infertility whenever the inability is regarding conception at all. Like the couple they have never conceived at all. That is primary infertility. While it's referred to as a secondary infertility when individuals or couples have difficulty in conceiving after already having a child before or having more children already. So it's secondary if it's about having more children, while it's primary if there had never been conception at all. There are factors that affect both males and females, and there are factors that are specific to each gender. So the male factors may range from issues that have to do with the sperm count or the motility, that's the ability of the sperm to move, or with the structure of the sperm itself. So the problem could range from the the quantity of the sperm that is being produced, or the ability of the produced sperm to move accordingly, or with the structure of the sperm. While female peculiar factors may include irregular ovulation, blocked fallopian tubes, or abnormalities within the uterus. So usually, whichever it is, a comprehensive assessment is always germane to determine what the underlying cause of the infertility is in order to profile treatment modalities. There are also some causes that are general to both males and females. So, and could include advanced age of the father or the mother, that's maternal or paternal age, When it's advanced, it becomes a risk factor. Hormonal imbalances or structural abnormalities in the reproductive organs of both the males or the females. Also, life factors can also impact infertility significantly, such as smoking or excessive consumption of alcohol. So infertility really affects a significant portion of the population, and the prevalence could vary based on factors like age and geographical location. So, speaking more about the reproductive anatomy, more like an overview or a revision. So, the male organs include, most importantly, the testis, which produces the sperm, and then the epididymis, which is where the produced sperm is stored. And then you have the vas deferens, which conducts or conveys the produced sperm during ejaculation. And you see along the line, you find accessorial glands like the seminal vesicle and the prostate gland. So the seminal vesicle will secrete fluids that are rich in fructose or prostaglandins and other enzymes. So the seminal vesicle actually produces the largest portion, about 60 to 70% of the fluids that end up making up the semen. So the semen will compose of both the sperm and the other fluid, additional fluid, while the prostate on its own, which is situated just below the bladder, as you can see here, is surrounding the urethra, right? So it produces this milky alkaline fluid that contains enzymes like the PSA, the prostate specific antigen, which helps to thin the semen and then enhance the motility of the semen. So during ejaculation, you will find the prostate playing an important role, such as contracting in order to close the urethra near the bladder, thereby preventing semen from entering the urinary tract. So this is the male reproductive channel. Before you then have the semen ejaculated through the urethra and out. So in the female, so still within the male, hormonal regulation also involves testosterone, which is produced by the testes, and it plays a crucial role in the production of sperm and in the male reproductive health generally. On the female end, you have the ovaries on both sides bilaterally, and it empties into the fimbriae, which is the terminal part of the fallopian tube. And the fallopian tube leads back into the body of the uterus, the uterine cavity, where you have the fundus right above here, and then surrounded by the myometrium and all that. So it is actually lined by the endometrium. So it's the fertilization would usually occur within the fallopian tube. So the eggs are produced at the ovaries, and the fallopian tube transports the eggs when you then have the uterus supporting the embryo development after implantation. And hormonal regulation also involves the production of estrogen and progesterone, which helps to regulate the woman's menstrual cycle and they support pregnancy. So let's now go dive into the ART. So by way of overview, assisted reproductive technology or techniques refers to those medical procedures that involve the manipulation of eggs, all right, or sperm or the embryos. What we are manipulating in order to assist reproduction could either be the sperm from the man or the egg from the woman or both, and then, or it could also be an embryo after the zygote has been formed, So all of this taking place outside the body in order to achieve pregnancy. And in some cases, some parts of it take place within the body, that's in vivo. So the primary goal of ART is to assist individuals or couples in conceiving a child whenever natural conception has become challenging or unsuccessful. There are different types of it. So I'll just break down a number of the key terminologies or the key techniques that we have. So we'll also talk about how to categorize them because it can be confusing to some people, but it's important to know what each acronym stands for. So let's start with intrauterine insemination, and this You can recognize intra means inside something, uterine, that's uterus. Insemination is a straightforward word. It means you are inseminating, more like you are inserting, right? You are inserting into the uterus, and that's what is happening here. So here is a sperm that has been collected and washed, okay, in this test tube, and then the sperm gets injected into the uterus, into the uterine cavity. So that's why it's called intrauterine insemination. So it involves the preparation and placement of the sperm directly into the uterus during a woman's fertile window, which is when she is, fertile, uh, during her reproductive age, thereby increasing the chances of fertilization. So it's usually recommended, as you may guess, in cases of mild male factor infertility, because the challenge here is that the male is not able to deposit active sperm into the into the female reproductive tract, which is why the only assistance being rendered here is to collect the male the male gametes, the male sex cells, which is the sperm, and deliver into the uterus. So that means the problem lies with the male, and it's a male factor infertility. So, or in cases of unexplained infertility, it's more like the first types of techniques to try, or when cervical mucus issues are present in the women, in which case the woman, it's a female factor infertility, such that the mucus within the cervix is blocking the penetration of the sperm that have been deposited in the vagina around here from crossing through the cervix into the uterine cavity. So this is intrauterine insemination. It's a type of assisted reproductive technique, and the success rate varies really, but IUI can be effective, while factors such as sperm quality will still be a thing to really consider. How quality, so long as the sperm is of good quality, and the timing of placing, of inseminating the sperm into the uterus. These are very crucial considerations to achieve success with IUI. Next, we go to IVF. So it's a very common terminology, and it could be of different types. So controlled ovarian stimulation. So like the name suggests, in vitro. Fish like vitro is glass, and this glass we're referring to is a petri dish. All right. So when you say something is in vitro, it means it's occurring within a petri dish. More like an opposite of, it's the opposite of in vivo, which takes place within the body. In vitro is taking place outside the body, particularly in a controlled laboratory environment. And the first step of that is, so by virtue of this, it means we are fertilizing the sperm and the egg within the petri dish. So the fertilization is taking place outside. In the case of IUI, like we just finished discussing, the fertilization still has to happen within the female reproductive system. So that is an in vivo fertilization and not an in vitro fertilization. I mean IUI, intrauterine insemination, because we are inseminating the sperm into the female reproductive tract in order for the sperm to continue the journey from that point into to meet with the egg, the ovulated egg at the ampulla for fertilization, right? So it's different from in vitro. So in vitro, the fertilization is happening outside, while for IUI, the fertilization is taking place where? Inside the body. It's taking place in vivo. So the first step of in vitro fertilization is ovarian stimulation. Controlled ovarian stimulation is the first step towards assisted reproductive treatment that is directed towards IVF. So either for artificial insemination or in vitro fertilization. And in addition, it is also necessary to stimulate the ovaries when a woman wants to, vitrify her eggs. That's to put her eggs in the glass, so to speak, to preserve fertility, and for women who are going to be egg donors as well. So the purpose of this ovarian stimulation is to achieve the maturation of several follicles at the same time in the ovary. So with this, the number of oocytes can you know, the oocyte that will fertilize the egg will increase, and with it, the number of embryos and the possibility of achieving a pregnancy also increases. So there are a number of drugs that are used to achieve ovarian stimulation in order to, and this could range from GnRH, that's the gonadotropin releasing hormone agonist. So agonist of the GnRH or antagonist of the GnRH. Okay, so all of this can be used, to restrain the pituitary in some of these protocols. Gonadotropin drugs generally, so they contain FSH and or the luteinizing hormone LH as active ingredients. So ovulation inducers are drugs that serve to achieve final follicular maturation and induce ovulation. So once the ovary has been stimulated using any of these drugs as recommended by the clinician, then the follicle is then punctured in order to obtain the eggs. Okay, the mature eggs. So follicular puncture takes place next, and then the semen by this time will have been prepared and washed and taken through the stage of readiness, preparedness for fertilization. So thereafter, they both meet in the glass, and this is where you have the fertilization, the in vitro fertilization occurring. And the in vitro fertilization could be the the standard one, or it could be the ICSI, which we'll come to in a moment. So IVF involves stimulating the ovaries to produce multiple eggs, retrieving the eggs, fertilizing them in the lab, and then transferring the resulting embryo into the uterus. Okay, so the embryo gets cultured within the lab environment until they reach a stage where they can be placed into the uterus. They can be introduced into the uterus through the steps known as embryo transfer, and that's the final step of it. So as for the fertilization, it can occur through conventional methods of just placing the sperm and the egg within the petri dish and allowing them to fertilize normally, or it may require a more specific procedure known as the ICSI, which we are going to be discussing in the next slide. So embryos are then cultured before then transferring them. So the success rate of IVF generally depends on various factors, including, the age of the woman, the underlying fertility issues. We'll discuss this risk factor in one of the subsequent slides before we end this presentation. So the risks could also include multiple pregnancies, the risk of IVF. So it's usually high. It's a high risk having multiple pregnancies, and then ovarian hyperstimulation syndrome could also be seen in IVF. It also warrants some ethical considerations, including how to dispose unused embryo and selective reduction, all of which we'll address before the end of this presentation. Now we are back to a third technique, and that's the ICSI that I mentioned not long ago. So the breakdown of the word cytoplasm, so intracytoplasmic sperm injection, which means we are injecting the sperm into the cytoplasm. Cytoplasm of what? Cytoplasm of the egg. So here you have the egg, okay, and then you have the cytoplasm of the egg, right? Then you have the sperm. This is the injection needle containing a single sperm. So the sperm is being injected directly into the cytoplasm of the egg that has been held using the holding tool. So there you have sperm being injected into the cytoplasm of the egg using a very fine needle. So ICSI involves injecting a single sperm directly into an egg to facilitate fertilization, and it's often used in cases of male infertility when the sperm is not able to penetrate the egg successfully. So a single sperm is then selected and injected into the egg using this type of microneedle shown. And ICSI is used when conventional IVF, that is just placing the egg and the sperm together in a petri dish, it may not be successful due to severe male factor infertility. So it's more invasive, as you can see, not invasive into the body, but invasive into the egg cytoplasm, all within the petri dish. than the conventional IVF, but can lead to successful, fertilization in certain cases. So our next focus are these two um, techniques. That's gift and zift. Gamete intrafallopian transfer and zygote intrafallopian transfer. They are two distinct techniques and they take place in two different places. It's important to bring them together because they seem quite similar in their names, but they are quite different in their locations of occurrence. So both of them involve delivery of the material, the reproductive material, into the fallopian tube. So intrafallopian transfer. So we are transferring the gamete into the fallopian tube in the case of gift, while in the case of zift, we are also transferring into the fallopian tube. But what we are transferring here is the zygote. So as for gifts, what we are transferring is the gamete. And this is both the male and the female sex cells. That's the egg and the sperm. Both gametes are being delivered into the fallopian tube. And this does not involve an in vitro fertilization. So this is an in vivo fertilization technique. It's not an in vitro fertilization technique. So it's not an IVF procedure. I mean, gift, that is gametes, because both gametes are being introduced into the fallopian tube, the sperm and the eggs are placed in the fallopian tube so that they fertilize naturally in the fallopian tube, and then they swim the fertilized egg. Now the zygote then swims into the uterine cavity for implantation. But in the case of zift, that's the zygote. A zygote is an already fertilized egg. It composes of both the sperm and the egg that have been fertilized. So zift is an in vitro procedure. It takes place, the fertilization takes place in the test tube, in the laboratory setting before the before the zygote is then introduced also into the fallopian tube, and thereafter it can then swim. The zygote can then swim back into the uterine cavity. So gift is an in vivo technique, while zift is not an in vivo but an in vitro technique because it's it involves fertilization outside the body. So zift is a type of IVF procedure, while gift is not an IVF procedure, but is an assisted reproductive technique. Okay, so ART is a broader terminology that refers to all of these techniques because it involves assisting reproduction. So they are all assisted reproductive techniques, but not all of them can be referred to as IVF. IVF is specific to when you are fertilizing outside the body within the petri dish. Okay, so gift involves placing unfertilized eggs and sperm into the fallopian tubes, thus allowing fertilization to occur within the woman's body, whereas zift involves transferring a fertilized egg right into the fallopian tube, thereby bypassing the early uterine environment. So allowing for the fertilization to have occurred outside the uterine environment for the early stages. So once the stability is established, then the zygote is transferred into the fallopian tube before it continues its journey embryologically. So both of these methods are suitable for cases where ordinary IVF, that's a standard IVF, where you fertilized and then you introduced into the uterine cavity, may not be preferred, or when it's not going to be successful. And whenever there is desire to allow fertilization to occur in a more natural environment, that's when you use the gift, that's the gamete intrafallopian transfer. Okay, so with the foregoing explanation, it is clearer now if how to classify these different reproductive techniques. So there are different ways to classify depending on what your perspective is. So we have IVF, in vitro fertilization. It's a type of ART. IUI, that's intrauterine insemination, is a type of ART. Okay. Intrafallopian transfer. This has two subtypes, as we now understand. So intrafallopian transfer, what are you transferring into the fallopian tube? Is it the zygote? It's a type of ART. Or is it the gamete, the sperm and the egg that you're transferring into the fallopian tube? So both of them are subtypes of IFT. And then you have the ICSI, intracytoplasmic sperm injection, in which case you may consider this as a subtype of in vitro fertilization, right? So it's you need to be clear. You need to just understand each of these types in order to be able to tell which is in vitro and which is in vivo. So this is in vitro. This is a standard one, right? And you deliver the product into the uterus. This is IUI. This is not an in vitro technique. The fertilization is going to occur in the female reproductive tract. So you are inseminating the sperm into the uterine cavity. So this is not an in vitro technique, but it's a type of ART. IFT, if you are talking about the ZIFT, it is an in vitro technique. But if you are talking about GIFT, it's not an in vitro technique. It's rather an in vivo technique. And then ICSI is an in vitro technique. Another way to look at the classification would be to talk about, okay, so ART divided into gamete or zygote, right? Whether you are dealing with the gamete or you are dealing with the already fertilized gamete, which is the zygote. So in the case of gamete, you are handling gamete that involves gift, right? So which is not an in vitro technique, or IUI, intrauterine insemination, in which case you are inseminating not only the sperm, you are inseminating the sperm into um, the uterine cavity. Okay, so this is also not an in vitro technique because the fertilization is going to happen within the body. Also, ICSI is also so here you are handling gametes, right? And because you are fertilizing both gametes outside, intracytoplasmic sperm injection, so it's a type of IVF technique. Okay, so it's an in vitro technique. When you are handling zygote, so IVF would mean you have already fertilized the zygote within the petri dish before then taken into the uterine cavity. Then in the case of ZIFT, you are delivering the fertilized zygote into the fallopian tube, or intrauterine transfer, in which case that's a product of after fertilizing that's a product of the IVF, the common IVF. So after fertilization, then you are transferring the zygote into the uterine cavity. So this is not confusing at all. What's important is for you to understand how each process takes, and then you be careful in the use of the terminology IVF as against ART, which is the more generalized terminology. So have you or someone you know experienced these techniques? Kindly share your story, in the comment section. I'd love to hear it. And do you have any questions about some other reproductive techniques that I didn't cover? Feel free as well to let me know in the comment section, and I'll do my best to produce an answer, to provide an answer. So going forward, about egg donation and sperm donation. So we have what we call donor eggs and donor sperm. So they may be used when individuals or couples cannot use their own due to genetic issues, infertility issues. So this is an issue of ethical concern, and is something that is not that is of big concern in some religious circles. So it's just for mention that this is usually some of the implications or some of the ongoing issues around the world of ART. So we have the World Egg and Sperm Bank, right? So ethical consideration includes the disclosure to the child that the father is actually not the owner of the sperm, or the person acting as the daddy is not actually the father, or the person acting as the mommy is not actually the mother, those are, and how to disclose this to a child after it has, after the child can understand. So legal aspects also involve consent before any of these things are done, and then the rights and responsibilities that come with them. So donors and recipients may face emotional challenges most at times, and counseling is often recommended to navigate some of these complexities. So another important issue in ART is the concept of surrogacy. And surrogacy simply involves a woman carrying a pregnancy for another person, or for a couple. So it's usually categorized into traditional and gestational surrogacy. In the case of a traditional surrogacy, the surrogate is genetically related to the child because her egg is used, such as a man, not rather than using the egg of the woman, employs a surrogate mother. So the woman, fertilization occurs through the artificial insemination using the intended father's sperm or donor, but the surrogate mother carries the pregnancy and gives birth to the child while she is the biological mother. Okay, so the surrogate is genetically related to the child because her own egg is used. That's in the case of traditional, that's what is referred to as traditional surrogacy. While in the case of gestational surrogacy, the surrogate woman has no genetic relation to the child. Instead, an embryo is created through an in vitro fertilization using the intended mother's egg and the intended father's sperm. So the embryo is thereafter just transferred into the surrogate's uterus, and she carries the pregnancy to term. So the surrogate acts only as a carrier of the pregnancy. That's why it's called gestational. And while the biological parents are determined by the genetical materials used. So you will agree that both types have ethical, emotional, and legal considerations that must be navigated carefully by all parties involved. So just to mention that these are also issues that are recognized in the ART, industry, or the world of ART. So laws vary globally, impacting the legality of surrogacy arrangements, and there are also diversity in religious perspective to this. So legal agreements are also usually essential. Emotional bonds between the surrogate and the intended parent, as well as ethical consideration, also necessitate thorough psychological support whenever this happens. So moving on is the concept of pre-implantation genetic testing. That is, we are conducting genetic testing of the developing embryo before it implants, right? So it aims to identify where there are genetic abnormalities in the embryos before implantation occurs. So here we have done an IVF, and then cleavage has begun, and then we have the tubing. So we tube the blastula, as you may want to call it, that contains a lot of blastomeres. So following a number of cleavages, and then we do genetic analysis. Or we also do that if the blastula has progressed to develop a blastocele in it, at which case we now refer to it as a blastocyst. Okay, so the blastocyst, we then tube that and also conduct genetic analysis. So there are different types of the PGT, that's the pre-implantation genetic testing. So there is PGT-A, and A stands for aneuploidy. So it aims to identify numerical chromosomal abnormalities. Aneuploidy, that's when we have something other than euploidy. Euploidy is having the normal chromosomal complement or chromosomal set, not the normal number of chromosomes that is expected. So it aims to identify when there is abnormality in this number, in this numerical chromosomal composition, known as aneuploidy. Okay, so this is particularly crucial for older women who are at risk of chromosomal abnormalities in their embryos as this increases with maternal age. We also have PGTM. So M in this case is monogenic or single gene disorder. So this targets specific single gene disorders that may be carried by the parent. So PGT really helps to identify embryos that are free from these genetic conditions before they implant, thereby preventing the transmission of hereditary diseases. So that's the essence of PGTM. We also have the PGCSR, which is aimed at looking at structural rearrangement. So this focuses on detecting structural rearrangements in the chromosome, such as translocations, and the likes. So PGTSR helps to ensure that embryos with balanced chromosomal arrangements are selected for implantation in order to reduce the risk of genetic disorders. So while PGTA assesses chromosomal numbers to avoid implanting embryos with abnormal chromosomal compositions, PGTM is specific for families that are known with single gene disorders in order to prevent transmission of these genetic conditions to the offspring, while PGTSR is employed when one or both parents have structural rearrangements in their chromosomes in order to improve, the chances of selecting embryos that have balanced arrangement. So the advantage is to reduce risk of genetic disorders, and limitations will include the potential for false positives or false negatives. At times you feel you've screened out, and whereas you really didn't succeed at screening. And this also involves some ethical considerations, like the potential selection of specific traits. How ethical is that? And then the impact on the future child. So another matter in the ART world is the concept of cryopreservation and storage. So cryo is referring to a very cold temperature, okay? So it involves freezing the eggs or the sperms or the embryo itself after fertilization, for future use. So these are liquid nitrogen tanks, okay, in which the preservation is done. So the storage duration is influenced by factors such as success rate or the legal regulations, as well as individual circumstances. So here are various nitrogen bottles or liquid nitrogen tanks. And ethical considerations regarding cryopreservation and storage includes decisions regarding unused embryos or disposal. How do you dispose them? And do you donate them? Okay, so what do you think as well? Do you think unused embryos should be donated for research or preserved indefinitely? Let's discuss this as well in the comment section. So, on our way down the presentation, there are a number of success rates that vary across the different procedures that we have considered. And they vary also based on individual circumstances. So there are success rates and factors that affect outcome of ART. And a personalized approach is always crucial in order to attain success. So it's not a one-size-fits-all thing. It needs to be understood what is the challenge of the individual that is undergoing or that is being recommended or being managed through ART. So these factors, the success rate factors, include the age of the woman, because the age of the woman is a significant determinant of the success. Typically, younger women generally have higher success rates because they are more likely to produce healthier eggs, and they have a more favorable reproductive environment within their body. Also, is whether the woman or the male has underlying fertility issues. So the specific fertility challenges faced by the couple or individual can also impact this success. And such conditions could include PCOS, that's the polycystic ovarian syndrome, endometriosis or male factor infertility, such as weak sperms or problem with sperm motility. So we also have the quality of the gametes. Okay, that's also a factor that is very critical, both to the egg and the sperm. So the higher the quality of the eggs, the higher the chances or the likelihood of a successful fertilization and the development of a healthy embryo. So going through ART also is also dependent on some of these factors to affect how successful it's going to be. Also, the quality of the embryo that is produced after IVF or after ICSI. Okay, so it's very is a key determinant to the success. A well-developed embryo has a higher chance of implantation to give a successful pregnancy. Also, the number of embryos that are transferred during procedures like IVF tend to impact the likelihood of pregnancy. So this is usually balanced to avoid the risk of multiple pregnancies as well as some other complications. Also is the lifestyle factors, such as the kind of food, the diets of both the male and the female, how well they exercise, how well they avoid smoking or excessive alcohol consumption. All of these could limit the rate of success, the success rate of ART, and also influence the fertility of a person individually naturally. The health of the uterus is also very key to determining how receptive the endometrium is going to be for the embryo or the gamete. Okay, so uterine abnormalities may affect or hinder the success of ART. Next is the sperm retrieval and quality for males. So in cases of male factor infertility, the method of the retrieval of the sperm also impacts the success rate. How they are retrieved and how they are washed and how they are preserved also gets to affect the success rate. Also, whether a woman has a previous pregnancy history, especially if there have been successful pregnancies, can influence the likelihood of success in the case of secondary infertility. Treatment protocol and the clinic expertise are also very much recognized factors. So how well the specialists, how expert the specialists are, can definitely affect how all of the procedures are handled. So well-established clinics with experienced professionals often have higher success rates. And then we end with the individual response to medications. Okay, so some individuals, the way they respond to ovulation stimulating medications at the stage of the first stage of IVF, which is the which is the ovulation stimulation. It can vary. So monitoring and adjusting the medication protocol based on the patient's response is very crucial for optimizing success. Okay, this is a repetition of the slide. So we now go into further issues about how much of income is streamed into countries that have a higher number of clinics where this reproductive technologies are carried out. The so the first issue to mention before going in depth into that is that the use of donor sperm by same-sex female couples have increased by 20% after the legalization of same-sex marriages. Okay, and that simply implies or it shows how much people had to subscribe into ways of assisted reproduction, why they believe they don't need, the opposite sexes or the opposite genders. So this had increased the subscription to ARTs by 20% ever since it got legalized in some countries. And an increase in the rate of infertility and obesity related cases is also driving the market. So it has increased how much that people subscribe and how much money that streams into the industry. The rise in the aging population of people across different society has also been shown to increase the chances of people not being able to conceive. And by virtue of that, ART comes into their rescue, okay, because they probably got married late or things like that. This also then brings the forecast that so this estimation was made before 2021. It was projected that the market would reach 27.99 billion US dollars by 2021. That's already 3 years ago. And we're talking about in Nigerian naira, for example, that will be 42 trillion naira, over 42 trillion naira. But of course, it came to pass because by 2022, it actually grew to 31.9 billion. And then by 2023, and then 2024, and now we're in 2025, by which time it was projected to have reached 55.3 billion US dollars. And that's equivalent to about 83.6 trillion naira. And this cost is including how much was made through instrument procurement, the procurement of how much money is spent on the accessory and disposable items, as well as the reagents and media that were used. Okay, that's the different color coding here. So this is how much is spent on instrument, then how much goes into the market of accessory and disposables, and how much goes into reagents and media cumulatively. So it's estimated that by 2032, that market would have accrued 179.4 billion US dollars. That's equivalent to 179.4 sorry, 271.3 trillion naira. So this, let's now look into the future trends in reproductive techniques, which is a field that continues to evolve rapidly with emerging technologies and groundbreaking research that will end up yielding these financial figures that we have reeled out. And one of the most promising advancements is the use of CRISPR technology, which allows for precise gene editing, because this could potentially be applied to correct genetic abnormalities in embryos in order to pave way, for healthier outcomes. Another exciting development is the creation of artificial gametes, which involves generating sperm and eggs from other types of cells, such as stem cells, right? So a stem cell, depending on the stage, whether it's still totipotent or pluripotent, can be applied, they can be harnessed or re-engineered, to offer a solution to individuals who are unable to produce their own gametes. So by converting them, making them become gametes. So this is what is meant by artificial gametes, and not necessarily silicon based, or something that is totally not biological. So additionally, we are witnessing significant improvement in embryo selection methods due to advancement in AI and genetic testing, right? So all of this, we have the ability to identify the most viable embryos. All of these are becoming, more precise and could dramatically improve the success rate in ART. So, however, as we push the boundaries of science, continuous research continue to unravel, and they remain critical to not only enhance the success rates but also minimize the risk and broaden the fertility treatment options for diverse population. Finally, it is essential to address the ethical implications, of these advancements. We need proactive discussions and frameworks, because these are very crucial to ensure that these technologies are developed and applied responsibly with societal values in mind and human dignity kept at the forefront. Because without this, the whole world will become chaos, right? And so the future of reproductive technologies holds incredible promise, but it also demands careful consideration of both the scientific progress and the ethical responsibility. And that's why we are going into some other issues that are critical, that are usually considered ethical in the case of ARTs. One of them is about embryo disposal. It's a sensitive yet critical topic of assisted reproductive techniques, embryo disposal. During procedures like in vitro fertilization, multiple embryos are often created to increase the chances of a successful pregnancy. However, not all embryos are used, which raises ethical questions about the disposition of these unused embryos. Individuals or couples that are undergoing ART face the ethical responsibility of deciding what do they do with their unused embryos. And this decision can deeply, it can be personal, it can be deeply personal and emotionally charged. So it involves navigating complex ethical dilemmas and considering progressive uh, perspectives in order to navigate the problem. So it's an issue. Options for unused embryos may include freezing them for future use or donating them, or you may donate for research or donate to other couples, allowing them to be used for so many diverse benefits. These are usually options that are trumped off in discussions like this, or choosing to discard them. So and each of these choices comes with its own set of moral, religious, cultural implications, because not every society will be, not every population or perspective is going to agree to some of these options that are usually touted in this discussion. So ultimately, the decisions regarding the disposal involve balancing personal autonomy with larger consideration, such as the potential for life, because it tends to give back to a new individual entirely, and the moral status of such embryos that will be formed. So these are very challenging choices that require careful thought and, in some cases, professional guidance to align decisions with personal values. And that's why this topic underscores the importance of ethical frameworks in every country or in every society where ART is going to be employed. And it requires thoughtful decision making in the field of ART. So let's see how many different perspectives we can gather on embryo disposal from you. Let me know your thoughts in the comment sections, and I'll feature the most insightful comments in the next video. Another ethically complex aspect of ART is selective reduction, which is a procedure that is sometimes considered in cases of multiple pregnancies. So it can occur as a result of fertility treatments like IVF, just like this, and it involves reducing the number of viable fetuses to improve the chances of healthy pregnancy and reduce the health risk to both the mother and the remaining fetuses. However, this practice it raises profound ethical questions because it challenges individuals and couples to grapple with the value and sanctity of each developing life. Which one do you remove? What's the crime of the one that is being reduced or the one that is being eliminated? So it makes it an emotionally and morally difficult decision, and that's why parents usually have to carefully weigh the potential health risks associated with the multiple pregnancies, such as premature birth or maternal complications, against their desire for successful pregnancy. These are decisions that are deeply personal, and of course, they vary depending on the individual values or cultural beliefs and religious perspectives. And to support patients during this difficult time, counseling services are always often provided, and these services would offer emotional support and guidance to help the individuals or the couples navigate the complexities of the selective reduction and make informed decisions that align with their values. So selective reduction really highlights at the intersection between medical necessity and ethical consideration. You would agree. It makes it a topic that requires sensitivity, it requires empathy, it requires professional support. So, have you ever been faced with having to make this kind of decision to undergo selective reduction? How would you approach it if at all you get faced by such? So let's have a honest discussion about this in the comment section as well. So we've highlighted the role of culture and religious perspective in all of what we have discussed. So I just thought to emphasize it a little more, because ethical considerations in ART will vary based on what culture you belong to, where you are from, and what religion do you practice. Okay, what does your religion say about some of these things? So all of these will end up influencing perspective on how to dispose an embryo, and how if how to undergo a selective reduction if you must. And it's these are perspectives that end up influencing one's respect for diversity, right? So healthcare providers would need to respect patients' religious understanding as well as their cultural background. So the healthcare professionals have to be sensitive to this diverse religious perspective and culture. You don't force your own opinion on a patient. So patients always have that right to exercise their religious understanding as well as their cultural belief to all of these issues. So what are your thoughts on the ethical dilemmas surrounding ART techniques? Can you please share your perspective as well in the comment section? I'll be looking forward to reading that. So we also have legal considerations. So legal frameworks may dictate the permissible actions in some countries. Some things may be possible scientifically, but are considered illegal, such as abortion in some cases, the disposal, what are you allowed to dispose for? So all of this influence the ethical decision making regarding embryo disposal and selective reduction in ART. And it's important to take note of that in whichever country you belong to, because you have to comply to the legal dictates of such country, and healthcare providers as well. So both patients and healthcare providers are obliged, to obey to observe legal compliance. So they must adhere to the relevant laws and professional guidelines of their society whenever addressing ethical considerations in reproductive medicine. So we've also highlighted the importance of counseling and support, because reproductive challenges can be emotionally taxing, and therefore underscoring the importance of psychological support. A patient that has been infertile for so long, or a couple that have been infertile for so long, and then having to go through ART and then still encountering some challenges, it's hard. It can be a very difficult moment, a difficult time. So as part of healthcare services would also be a necessity for counseling and support. So ethical decision making is a complex and emotional process, and it requires counseling services which are provided to help individuals or couples to navigate these decisions, thereby providing them with emotional support and guidance. So it's counseling is a tool that helps to cope with the emotional challenges in order to make informed decisions at the end of the day. Access to resources and support groups, it really facilitates shared experiences and emotional assistance. So in the light, to make up this lecture, these are resources that were consulted. You may feel free to read further, or to consult these resources to have further information. So at this point, I want to thank you very much for joining me today as we explored the fascinating and sometimes controversial world of assisted reproductive techniques. I hope you found the episode enlightening and thought-provoking. So do you know someone who might find this video useful or thought-provoking? You can feel free to tag them in the comment section and share the link as well. If you also enjoyed this content, I hope you won't forget to give it a thumbs up and share with your friends, and hit the subscribe button as well so you won't miss the next exciting episode. So I'd love really to hear your thoughts. Particularly, what are those things that resonated with you the most? Do you have any questions or perspective that you'd like to share? Let's continue the conversation in the comment section. So until next time, I'm Dr. Rehan Falari, and it's been a pleasure guiding you through this journey of ART and its ethics. Stay curious, stay informed, and I'll see you in the next video. Bye.